know from years and years of studying best practice in all fields of healthcare that sometimes it spreads slowly, and simply publishing the results of effective measures to improve quality or reduce risks of care isn't enough. That tends to be something that's picked up by the enthusiasts. What you want to do is look at what's necessary to reach the majority. And I think that's much less about journals, which are, although they're important, but it's much more about getting people together, talking to them, getting to share experience with others. So it's the people side of it rather than the academic side of it that will bring about the large-scale change. If I look at some of the successful measures, I think we've seen the much greater compliance with hand hygiene practices in hospitals, which have been part of the program for the WHO Clean Care is Safer Care. We've seen reductions in intensive care infections in the work that Peter Pronovost has done in the US and other countries, and we've been part of that with the WHO. And we've seen adoption of the checklist and in some places a reduction in the risks of surgery. But that has been a limited success. We've seen it in some places, but not others. And so again, we need to try and reach the majority and understand why best practice is implemented in some places, but it's not really penetrating and being implemented in others. That's the major challenge, to get beyond the centres of excellence, the places where people are enthusiastic about safety, to the places where perhaps they're not doing enough and they could do more. The World Health Organization has just revisited its program after a very successful 10 years, and we are now setting out some new ideas for the future. We're likely to have a third challenge, which will be medication safety. We know that that's very, very important. Medication errors make up a substantial minority of the harm that occurs. And although there have been reductions through electronic prescribing and things of that sort, it's still a problem and it needs to be tackled. There's also a great deal of attention being given to the fact that we know relatively little about patient safety in primary care. So primary care is going to be one of the other priorities of the WHO program over the next 5 years. And then also the educational curriculum that WHO produced, developing that further, developing leadership programs in education for patient safety. That's going to be another priority. Well, I think the direction of patient safety worldwide over the next 5 years has got to be cracking, learning, making effective change that reduces risk and harm for patients. And that's probably the most difficult challenge of all. There's no easy answer to it. It involves understanding much better the causes of harm. It involves engaging patients and families much more than they have been in the past. But more than anything, I think it involves making inroads into the level of knowledge and enthusiasm and passion that healthcare workers, doctors, nurses and others have around the world, so that we have much better staff engagement than perhaps we've seen over the last 10 years. I think if I could make one change to improve patient safety, it would be to have it as a core component of educational curricula, both undergraduate and postgraduate, for all healthcare workers, and teach it in a way that makes them passionate about the subject. So that means bringing in patients and families who've had bad experiences or tragedies of care and letting them tell their stories in a way that reaches people's hearts as well as their minds.